Healthcare misinformation, an artificial intelligence challenge for low-resource languages. In this talk, we will first discuss how AI for social good translates to developing nations. Then we will propose machine translation for narrowing the information gap about public health. Finally, we will discuss two pilot studies using our proposed machine translation framework. From the perspective of developing nations, AI for social good is often perceived in the same light as international aid, but it reflects more the priorities of the wealthier nations than the developing ones it is supposed to help. Most African nations would prefer aid in the form of access to the same resources as wealthier nations. Two very crucial gaps are in access to information and AI expertise. One recent study estimated that nations that are leaders in AI technology stand to gain between 20 and 25% in economic benefits through the development of AI technology. Yet these opportunities are not to be found in most of the developing world. Machine translation is itself a technology that can help narrow these gaps by making information more accessible to those who do not speak developed world languages. To illustrate the impacts of colonialism on information gaps, let's compare the British and French approaches to education in their African colonies. Africa delegated responsibility for education to missionaries in a decentralized fashion. This made education relatively cheap and accessible. As a consequence, the former British colony of Ghana now has a very high level of English literacy. By contrast, France, which implemented a highly centralized and bureaucratic education system in their colonies, resulted in education that was accessible only to the wealthy. And now only about 20% of Malians, a former French colony, are fluent in French. These policies have had lasting impacts on the abilities to rapidly convey critical information during the public health crisis such as COVID-19 to the 15 million or so Malians who cannot understand French. We propose a machine translation system with humans in the loop to automatically convert large volumes of developed world information into a form that is comprehensible to those who do not understand English or French, while simultaneously providing a platform to train Malians as translators through a multi-tiered crowdsourcing workflow supervised by expert mentors. As first steps toward building this system, we conducted two pilot studies, one on the human tasks involved, the other on the machine translation challenge. We conducted the human computation study offline, but gave participants the tasks they would be expected to do in an online setting. 7 participants translated 2 French texts, one Wikipedia article, the other a Malian news transcript. 4 of the participants provided written translations, a seemingly daunting task because written Bambara lacks the same level of standardization as higher resource languages like French or English. The remaining participants provided spoken translations. An evaluator with a high level of proficiency in both French and Bambara evaluated the translations on a percentage scale on 3 qualitative factors: how well the translations captured the exact meaning of the French text, how literally they captured the French text, and the degree to which the translations conform to standard Bambara. In addition, we measured the pairwise blue score among each pair of translators. Our results showed that written translators did a better job of capturing both the exact and literal meanings, but spoken translators did a better job of capturing standard Bambara. The higher performance of the written translators could reflect overall higher levels of literacy among them compared to the spoken translators. Our pilot machine translation study was based on a multilingual dictionary that loosely aligned words and example sentences in French, English, Bambara, and Spanish. The alignment, however, was not perfect and too complicated for automatic alignment tools to handle. So we built a simple computer-based tool to assist manual alignment, and were able to align over 2,000 examples between French, Bambara, and English. We used the Joey NMT transformer model built on top of PyTorch designed for low-resource languages for our translation experiments. We conducted bilingual translations between Bambara to and from French and English. We considered 3 different model input units: word, byte pairs, and characters. We also considered BPE dropouts. For each language problem, we evaluated each of our models on our training data and then selected those that performed best to evaluate on our test data. The results showed that the BPE models without dropout uniformly performed best on all problems. And interestingly enough, the French translations performed better on the tests than on the training data. In conclusion, machine translations for under-resourced languages show great potential as an application of AI for social good. Our pilot test showed that human computation is likely scalable, but will require exhaustive guidelines to improve translation consistency, due in part to the lack of standardized spellings and other conventions in written Bambara. Future work will seek to integrate language resources specialized for the medical domain.